Hello all, welcome to Sakshi TV and welcome to your NRI show Ask Your Doctor program. Today we have with us our esteemed guest Dr. Sailaja Reddy. Dr. Sailaja Reddy practices internal medicine in Boston and she is a quadruple certified both in functional and also conventional medicine. So without further delay, let's please welcome Dr. Sailaja Reddy to our show.
Hi Madhuri, thank you for having me here.
Can you please introduce our viewers about yourself and your background?
So like I said, I'm Dr. Sailaja Reddy. Diminutive for my name is Dr. Shaila, Saila. That's how I go by on the social media. I am conventionally trained and functionally trained medical doctor. So I'm actually an internist. I've been practicing in conventional medicine for almost 27 years, I would say. For the past 3 years, I switched my practice into a new paradigm of medicine. It's called functional medicine. Even though the practice is internal medicine, but the approach we do now in functional medicine is very different from what I used to do. So I treat gut-related conditions. That's my field of expertise in functional medicine.
What interested you to switch to this new paradigm of functional medicine? And can you explain our viewers about your journey towards this?
For a long time, actually, since I was a child, I was more interested in a holistic approach. But in those days, my mom used to give all these herbal tinctures and all when you get sick, right? So that interest was always there. So when I came to the USA about 30 years ago, I was very busy. Never paid attention to what I was eating, obviously taking the exams and having children, a lot of responsibilities. So at that point, after I had my second baby, of course I had trouble keeping my pregnancies also, that's how it started. And 3 years after I had my second baby, one day I was admitted in the hospital because I had bruises all over the body. And went into the hospital, my platelet count went down from 240K to less than 10K. And they told my husband that she has only 50% chance of survival. I was almost on the deathbed in one of the top hospitals on the planet. And so it was a shocking thing for me. So why this happened to me, why I had all the miscarriages and things like that, I must be doing something wrong. I knew what I was doing in those days was not right thing. I used to go to fast food places. Whenever I was hungry, I didn't feel like cooking at home. So my lifestyle was very poor. Then, fortunately I survived. And when they were discharging me, they said, oh, don't worry, next time if it happens, we can just get your spleen out, you'll be fine. I'm like, wow, I don't want this to happen. Then I dig deeper and I wanted to take care of that naturally. So that's when the interest, started. Then I went to holistic websites and I took my certification in holistic medicine just for fun, actually. I had no interest in starting my practice. And then I joined a group in Boston. It's called Raw Food New England Community. I really loved that group because they were all so healthy in the group. And I used to go for their potlucks and they used to present me with the books. Then I learned about functional medicine in my research and I said, this is what I want to do. It took me about 7 years to get the complete education on integrative medicine and functional medicine. So then I said, I cured in a way I can say I cured everything, like that low platelet things never came back. And I used to have a thyroid problem, which was naturally treated. I used to take a very high dose of thyroid supplements. I no longer take any supplements. And because I was doing all these things to myself and my family, then it was a conflict inside me. Why am I giving the pills to my patients? When I'm not taking it for myself, then why can't I switch the field? So I should have done this a while ago, but it was for financial reasons. My kids were in college. I was a bit nervous to start a completely new practice, leaving a well-paid job. So I waited and I started my own practice 3 years ago. Now I'm just loving it. It is very rewarding.
Wow, that's really inspiring. I mean, that's like a very inspiring journey. So I have seen your specialty is gut. Mm-hmm. So can you please let me know how do we relate the chronic diseases like cholesterol and other diseases to the gut?
Mm-hmm. Yes, gastrointestinal tract and related conditions are my special interest because GI tract is the center node for the web of functional medicine. Because thousands of years ago, Hippocrates, father of medicine, said everything starts in the gut, which I totally agree that GI tract is a very important thing. So we all have the lining in the gut. Basically, when you eat something, it's an external surface. Only when it passes that lining, then it enters our body. So that lining is such an important lining. It is a razor thin lining. So if there is any increased permeability there, all the toxins in from the bacterial toxins and the undigested food and a lot of things like gluten, and they all create this leaky gut, that is layman's term, which is a hyperpermeability of the gut lining. So when that happens, the substances that are not supposed to get into your body, they get inside. So they're supposed to be eliminated, undigested food, all the toxins. So once they get into your bloodstream, that triggers the inflammatory cascade, and you have inflammation in several parts of the body. But doesn't matter where you have the pain, what name you are giving to the disease, the root cause for that is, for most of the conditions that I know, it is a leaky gut. Just by correcting the leaky gut, you are treating several conditions. So for example, if you say like cholesterol, right? So having a high cholesterol, I've seen some of my patients who had high cholesterol genetically, but they're very healthy people, they eat very good. So we have to look at the fractionation of the cholesterol. You just don't look at one number and say that, okay, you have a high cholesterol. And also, whenever I see a patient with a high cholesterol, I look at the inflammatory markers. So you need to look at the inflammation the patients are having. So rather than just focusing on the cholesterol, you have to focus on the inflammation and treat the inflammation. That then you are putting yourself at lower risk of having any cardiovascular events. So focus both on the high cholesterol and the inflammation that you're having, which you can control again by keeping your gut lining intact.
That's really good information to know. I did not know about all these. I'm sure my viewers would be amazed to know that. So that brings me to our next question. Can you tell us, like, what are some of the healthy habits that we can maintain to keep a healthy gut?
So this is a very important message that I want to give to the viewers, is because nowadays I look at not only younger generation but even the busy moms and everybody. It's so easy to go out and buy the processed food, and it's so easy to go out to the restaurants and eat the food. So anytime you go out and get the processed food, that's not something that Mother Nature wants you to eat. So I would say, if you, whatever you're putting it in the mouth, this is a simple way to ask is like, see whether your great grandmother ate the same thing. Or if you see a long list of ingredients, then that's not for your gut. So you have to look at the list of ingredients and try to use as less processed food as possible, and whatever you eat, make sure it's closer to what Mother Nature gave us, in the form that Mother Nature gives us. If it is processed too much, then I would not eat it, but that's only one part of it. The other part of keeping yourself is healthy is like having a good night's sleep and exercise and nutritional status. You need to know, sometimes even you feel like you're eating healthy, you may not be absorbing all that, you may not be assimilating all that inside. So all these things, if you keep in control, healthy, those are the healthy habits, I would say.
Nice. Thank you, Sailaja. Those are some of the things that we tend to ignore, but those play important role. I have looked through the website and I have seen a lot of information about various things that are commonly covered and most of us have. So one of the questions that we had was, how do we identify chronic fatigue? Mm-hmm. Because we feel tired every day, but how do we know that this is something serious and we are having a chronic fatigue?
So there's actually a long explanation. I'm trying to make it simple when you say chronic fatigue. Because chronic fatigue could be a symptom for many other conditions. When you have a chronic fatigue, there could be several reasons, and unless you do the blood test, you won't be able to come up with the exact cause. But in general, if your immune system is burdened with toxins, like it could be a bacterial toxins, it could be the environmental toxins, it could be the radiation, or like mold, many toxins are there, or it could be the nutritional deficiencies. When you have any of those conditions, our body has this, there's something called triage theory, and it says the body has two kinds of proteins, survival and maintenance proteins. The priority is survival. Even if you have a nutritional deficiencies, that survival factor, body pushes everything for you to survive. Even if you have a nutritional deficiency, you're still going to live, but you're going to survive, that's all. That's why you have the fatigue, because the maintenance stuff is not there, right? So you want to make sure you don't have any nutritional deficiencies, and you want to make sure that your body is not loaded with the toxins. So because I'm seeing a lot of patients with the same thing, like a chronic medical condition, so I see that when we have the testing also, advanced testing that we do for patients. So when I do the testing, they have several inflammatory factors that are positive, and there's so many toxins in the body, and some people are loaded with mold, and that's why I recently actually started a detoxification program. That's a 6-month comprehensive program, so where we look at the toxins and unburden the immune system. We all have this natural, like an innate healing capacity. So if you help a little bit to our immune system and to the body, it knows how to correct it. So you don't have to go and correct each and every toxin, but it needs little help. You have to basically give that raw material to the body. It knows how to correct it.
Oh, that's nice. That's what I'm telling you. Like, I go over your website, and there's so loads of information that most of us relate to, right, because it's like day to day, what you eat, what you do, and how it affects your health. That's
so it's really, it fixes a lot of, I shouldn't say fix, it regresses a lot of chronic diseases. Because the people, I have seen like so many cases, God is the witness, and so many reversals. Like when they come, there was a patient who came to me with a vertigo like a ringing in the ears, and she was given a hearing aid, which is just a band-aid, and she came to me like, I don't know what to do, and I don't promise, like, I'm not going to fix it, I'm not a fix-all doctor. I said, okay, I'll try my best, and let me see whether I can correct this problem. When she saw me like one-on-one for several months, there was only slight improvement. Then I put her in my detox program. Just 2 months after the detox, her vertigo was gone, and she threw away the hearing aids, and she was like super thrilled. There are like so many things like that. That was just one example. So there are so many testimonials about the gut health improvement. One patient was almost like suicidal. She flew from India, and she didn't even know that there was something like this. Everybody in India was telling her, like, oh, there's no treatment, you have to live with this antacids, which was not helping her. Then after she came and we corrected her gut lining, and she had seen drastic improvement. And the people who had severe depressions also can,
yeah,
improve.
that was my second question. You just brought me into it. What would be your approach about depression? Because since it's so common, especially even in the younger generation, they say like, I'm depressed, I don't know what to do, I have anxiety, and all such things. So what would be your take on that?
So I'm going to tell you a funny incident that I had. When my boys were young, I used to take them for skiing. My husband was not into skiing, so I used to take them on the chairlift. In those days, I told you, like, my lifestyle was very poor. So I had severe panic attacks. So one day I was so close to jumping down from the chairlift. That's how bad I had a panic attack when I was on the chairlift with 2 boys next to me. So I didn't know. I went to the psychiatrist and took medication, and I took this medicine that was given only for 3 days. Then I decided I am not taking this medicine anymore. Then I did research, and I wanted to correct it naturally. So then I had seen drastic improvement. Today, if you take me to a forest and put a hammock there and ask me to stay there, I can happily stay there. The mood has improved so much. It's well balanced. And why? Because our gut, once you correct the gut issues, and these neurotransmitters like serotonin and all, they're produced in your gut, more in the gut than in the brain. So there will be a lot of imbalance once you correct the gut, and once you have this good bacteria, once you balance the bacteria in the gut, that's going to improve your mood a lot. have seen it myself, and I've seen it in so many patients. One day I still remember, that was before I started my functional medicine practice. One of my close family friends, they knocked my door like around 11 p.m. I'm like, why are they knocking my door now? And husband and wife come and they say, like, my wife is having like a severe panic attack and depression, almost to a point of suicidal state. Then I obviously told them to go to the hospital. They're like, no, we're not going. We decided on that. You just do whatever you can. Then, of course, I kind of gave her some counseling. And then with some knowledge that I had before I started real practice, now I have better tools. Whatever little things that I did her, like, correcting her gut and giving her some supplements, within 2 weeks, this person who had such a severe panic attack was almost normal. She still, thanks me whenever she sees me, like, maybe it may not all be the supplements, it could just be the support that we gave. And but I've seen several people whose depression, anxieties, and they all get corrected once you repair the gut.
That's nice. I mean, I'm hearing so many amazing things today about gut and how it affects your overall health and your overall personality. That's really great to know. So now this is one more question. You are a certified functional diagnostic nutrition.
Mm-hmm.
Can you give us suggestions about our viewers who are like vegetarian about diet, or because a lot of South Asians are vegetarian, so I would like to know more about that.
So I know that we all have this general impression that the vegetarian diet is the best diet, but I have like a few corrections to make in that vegetarian diet. So I don't recommend gluten at all. So the gluten is in the wheat, right? So we think that eating roti is the best thing, like, but a lot of times, in my experience at least, what I'm seeing is, even the research says that the gluten tends to irritate your gut lining and give you the leaky gut. Some foods are problem when you already have the leaky gut. But gluten is one of those foods that can give you the leaky gut. That's actually more of a concern when you have genetic propensity. Like there are 2 genes called DQ2 and DQ8. When you have those genes, I test those genes for a lot of my patients. So that's, even though you're a vegetarian, if you're consuming a lot of gluten, that could be an issue. And again, this diet is generally not one diet fits all thing, If you people think that the paleo diet is a perfect diet, but sometimes it's not. It doesn't have that much fiber that your body needs. And vegan diet has its own disadvantages. It could give you like a B12 deficiency, and you have to make sure you don't have that, and you need to correct the B12. But in general, I would say anything that you're eating, just eat in the form that's close to Mother Nature, and you eat like less sugar. That sugar is, in my opinion, it creates a lot of inflammation. And I personally don't eat that. I used to eat a lot of desserts and sugar and the grains, but now my diet contains less grains and more of the fiber containing foods, and some good fruits which are not too sugary fruits, like with more polyphenols like berries, things like that. And just have a nice blend of all the foods that you eat, just vegetables, fruits, and I would say you have to include the live food. Live food means like sprouts. Like if you sprout it, the Mother Nature designs the sprouts in such a way that it's easily digestible, and it gives you the good quality protein. In my opinion, it's a better protein than having too much of the non-veg protein, because it's easily digestible. Your stomach doesn't have to use that many digestive enzymes, and also that's why you have to have nuts, sprouts, and beans, lentils, and you have to include proteins in the diet when you're a vegetarian. Don't just depend on the green leaves and the vegetables. Make sure that there is some protein in there. And most importantly, you have to make sure your digestion is proper. The reason I'm saying is we all need hydrochloric acid, which is produced in your stomach, right? So interestingly, I've seen a lot of videos where people say that you have to eat peacefully, right? For example, even in my home, my husband watches TV, sometimes he eats. I tell him, no, just let's sit on the dining table and eat. Like when you eat, when you are calm and when you eat in a happy mood, in fact, the body produces a lot of hydrochloric acid, which is very important for the digestion. And also you have to chew the food properly. Just by eating the vegetarian food, you're not really absorbing everything. There are some enzymes in your saliva, which is amylase and those. So you have to make use of those, and then some of the digestion is done already when you're chewing it. So the stomach doesn't have to work that hard. So eating calm and those things are very important, like having a good night's sleep. When you're too stressed out, doesn't matter how healthy food you're eating, you're probably not digesting and absorbing and assimilating them well.
Gets me to another next question. How do you identify an unhealthy gut?
Unhealthy gut, yes. The common symptoms of unhealthy gut are like bloating, indigestion, constipation, acid reflux. Even though you think that the acid reflux is just coming from your stomach, this is all like a long pipe. Like, if you have problems in your small intestine or the large intestine, that could still present as acid reflux too. So if you have long-time constipation, so I have like several people who came and did our detox program, which is like a gut healings, basically gut repair. There are 2 months of gut repair in that program. So they felt so much better, and lifetime constipation was gone actually. So for some of them, so you have to clean your gut and keep it healthy. Don't just dump all the junk food that you get outside. You have to take care of it. It's like a temple, it's our body. If we don't take care of it, who else will come and take care of our body?
That's a correct way. That is correct, actually. You have also talked about thyroid. Thyroid is another one of the most common disease that a lot of South Asian population have, be it hereditary or something. Are there any things that we can do to keep it in control? So
it depends on, there are several conditions, but the common thyroid issue is a low thyroid thing, which is called Hashimoto's, which means like an autoimmune condition. Autoimmune means, just to give a brief description of what autoimmune conditions are, our immune system is supposed to recognize our own cells, right? So if our immune system lacks the capacity of just going and identifying your own tissue and not presenting it to the immune system that it is our body, right? So our immune system tends to go and attack the thyroid, just an example, thyroid gland, and produces antibodies, and it stops the production of thyroid hormone. So for that, we are giving the thyroid hormone, which is actually a band-aid. Like you're just giving some supplement that your body is not able to produce. What I did personally to my thyroid problem is you correct the immune system. You just unburden the immune system so your immune system can recognize your own body. Thyroid is just an example. There's so many autoimmune conditions. You have like a Crohn's disease, multiple sclerosis, and autoimmune myositis, and autoimmune liver conditions. There's several autoimmune conditions are there. Just depending on which part of the body is involved, we are giving a name. And you have to correct the base for this autoimmune condition. You just improve that immune system. And if you just ask me to your question, if I want to answer specifically for the thyroid, yes, there are like iodine, selenium, all these things are essential for the thyroid hormone function. So you can take the supplements, but you have to make sure that you're not overdoing it. So you have to monitor it and correct the gut, which is the base for your autoimmune function, and to clean up the immune system if you have any toxins.
So that is like this is my favorite thing. I've seen on your website that you've created a group called Gut Healings Detox Group, and now I have seen you go over some of the cases that you have done with the group. I would like to know more about the group that you have created.
So this is a detox group that I've created because I didn't have it initially when I started my practice. I used to see my patients one-on-one. Then I realized that it was taking up so much of my time to counsel each and every patient. Then I said I wanted to give better education to the patient. Some people, they want to go home and watch my video, right? They want to listen what I want to say. So then I created this platform where I have spent hundreds of hours creating the videos, and there are several modules which are released in a self-paced fashion. So the reason I did is because there is a substance called LPS, lipopolysaccharide, which is a very strong toxic substance that is released from the bad bacteria in the gut. Once it crosses and enters our body, it's giving a lot of inflammation. Inflammation is triggered when it enters the body. That's basically root cause for many chronic diseases. That's why I have decided to educate the patients on what changes they have to make and how they have to clean the gut and how they have to clean the immune system. All these things require at least like a minimum, 60 to 70 hours of education, which I was not able to do it for each and every patient. So I created this virtual group program. Anyone in the world can access my program, so I can multiply my time to all these patients. I want to serve more people in a less amount of time. So once I create this, anyone can join my program.
Oh, nice. That is really inspiring, Dr. Sailaja, because see, suffering through the disease, autoimmune disease that you had, and you could as well say, okay, I'm done. I can lead my life, but giving back to the community
Yes.
is such a great thing that you have been doing, and these online detox group, and I myself am so interested now. I'm going to go and watch more and more of your videos now. Lastly, do you want to give our viewers any suggestions?
So, like I've said, just think that your body is a temple and eat clean and have the clean thoughts, and movement is important. Exercise, be out in the nature, that is so important. I know people go to the gym and do the exercise. Personally, I like to be out in nature. There's so much research about it that nature is good for you. And and your thoughts matter too. So keep your thoughts healthy too. That's my advice. And if you would like to know how healthy you are, there is a quiz actually on my website, which is roothealthmd.com, and on the social media also, my handle is roothealthmd or Dr. Saila. So you can follow me there and just take the quiz. It's a free quiz on the website, so it tells you how your health is. Thank you.
Thank you.